Visit the Medical Corner on your4state.com and get answers from true medical specialists.
I'm Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Do you have heel pain, plantar fasciitis, toenail fungus, bunions, or hammer toes? From pediatric to geriatric care, from diabetic foot care to flat foot reconstruction, if it's below the knee, think of me for your comprehensive foot and ankle care.
Click on Medical Corner at your4state.com. Visit the Medical Corner on your4state.com and get answers from true medical specialists.
I'm Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute with convenient locations in Frederick and Hagerstown. If you or someone you love has foot pain, you should know that this is not normal. Contact our office to speak with one of our physicians. We're here to help. From toenail fungus to broken ankles, if it's below the knee, think of me for your comprehensive foot and ankle care.
Click on Medical Corner at your4state.com. Make it your homepage.
Feeling pain on the first step of the day or after sitting? Don't let heel spurs, bunions, or calluses prevent you from living your life. Is foot pain, hammer toes, or a wart turning everyday chores into painful tasks? Dr. Dan Michaels is board certified by the American Board of Podiatric Surgery and wants to meet you to discuss caring for all your foot and ankle problems. Using the most current treatment and technology available, Dr. Michaels will have you back on your feet in no time. Why wait? Why suffer? Call Dr. Michaels at 877-797-FOOT today.
Welcome to your4state.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you here, Dr. Michaels.
Thank you, Angie.
Our question for you is, what is metatarsalgia?
Well, metatarsalgia is a term that describes forefoot pain. There are a lot of structures in the forefoot, and if you look at the foot, there are 5 metatarsals, and anytime you have pain in the forefoot, it could be caused by something called metatarsalgia. However, that's a very general term. Oftentimes, it can be caused by pain or inflammation of one of the structures in this area. If you look underneath the big toe, there are 2 little sesamoid bones, and everybody has these. And their purpose is to distribute force along the big toe, as that toe takes the majority of the pressure in the forefoot. However, sometimes these bones can fracture or they can become inflamed. Now, if you look at the second metatarsal, there are tendons underneath the bottom of each one of these toes. And the second is interesting in that the bone is very flat on the bottom and it compresses the tendon. So if there's any change in length or position of that bone, the second metatarsal, then that tendon can become inflamed and that tissue can become very painful. Conversely, there are things that can occur in between the bones, such as nerves becoming inflamed, and those are neuromas. However, sometimes when one cannot differentiate the exact cause of the forefoot pain, and it can be somewhat diffuse, metatarsalgia is a term used to describe that condition. Oftentimes, however, there is a structure that can be identified that is inflamed or pathologic in some way that is causing that pain, and treatment can be dealt to that specific object independently, and the problem can be resolved with conservative treatments, usually in the office.
Now, you just mentioned treatments. How is metatarsalgia treated?
It depends on what actually which structure is actually causing the problem for the patient. Oftentimes, however, an orthotic device can be beneficial for the patient. This is a custom-made orthotic device which is designed to take the pressure off the forefoot or the area that's causing pain for the patient. For example, if the second metatarsal is causing a lot of pain, then we can put a pad on the bottom of the orthotic device to take the pressure off this bone. This treatment is not very difficult, and it's pretty easy to explain to patients what's going on and how to treat it. Sometimes, like in this orthotic, there is a pad underneath the big toe, and that can help sometimes pathology or pain in the big toe area. And then finally, sometimes people put pads in the middle of the orthotic, which can take pressure off the central metatarsal area, which can decrease pain from an neuroma. So a lot of the treatment is dealt with in the office. It's conservative. Oftentimes, shoe inserts or braces can be used. Sometimes injections may need to be done, and then finally, if nothing else works, there are surgeries for all of these conditions. And most times with these surgeries, people can come in the same day, they can be awake for the surgery, and they can walk that day on the foot.
All right, thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can ask your specialist questions on foot and ankle conditions only here on your4state.com. Welcome to your4state.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you here, Dr. Michaels.
Thank you, Angie.
Our question for you is, what is hallux limitus?
Well, hallux limitus describes the big toe. The hallux is the big toe. And limitus, it doesn't move. So if you have the foot model here, the big toe usually goes up and it goes down. But in this case, with hallux limitus, it doesn't move that much. That can be caused by arthritis. Sometimes, this joint takes a brunt of the force in the forefoot, so damage can occur to this. For example, if you stub your toe as a child or a young adult, or you had trauma to this area, it may not hurt right then, but that could have damaged the cartilage in the joint, which then degrades over the years, and later in life you have bone spurs forming in this area, and the bone spurs that form on the top of the toe can prevent the toe from going up. And oftentimes people have some degree of this, but they're not symptomatic. They don't have pain. And if it's not painful, you don't really need treatment. But if it does become painful and debilitating, then something needs to be done about that. It can also be caused by elevated first ray. There are certain types of foot conditions that can cause malalignments of some of the bones, and that can cause a structural problem where the big toe doesn't go up. So it's not always caused by arthritis, but usually.
All right, how is hallux limitus treated?
Well, we try to treat hallux limitus conservatively first. Everything we do is usually conservative, and then we move on to surgical treatment. So one of the things that we do for this primarily is to wear and recommend really good shoes. The shoes for this that would help are stiff-soled shoes. They shouldn't bend, because if you're having pain when the big toe bends because of the arthritis, then if you wear a stiff-soled shoe, your big toe won't bend that much. And I know a lot of the stores and our office sells really stiff-soled hiking shoes that are designed for off-road use. In addition to that, orthotics, custom foot orthotics with a thickening underneath the big toe can provide some relief for this. And those two things, the orthopedic shoes or the stiff-soled shoes and orthotics, are really the best ways to treat this conservatively. Now, sometimes we can do injections of steroid or of a joint fluid replacement for this. And sometimes if the steroid doesn't work, then you do the joint fluid replacement, which is fairly new, and not a lot of people do that yet. But it has shown that one of these joint fluid replacement shots can work for about 6 months. And then finally, if that doesn't work, then surgery may be indicated. And usually it's a surgery where you can be awake, you can walk that day. It's simply a clean-out procedure where we take out some of the arthritis. Sometimes something more advanced needs to be done, but usually the clean-out procedure takes away the pain and takes away the bone bump, and people have their symptoms resolved right after that.
All right, thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Don't forget, you can ask your specialist questions on foot and ankle conditions only here on your4state.com. Welcome to your4state.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you here, Dr. Michaels.
Thank you, Angie.
Our question for you is, what is rheumatoid forefoot disorder?
Well, rheumatoid arthritis affects many millions of people throughout the United States, and it can cause problems in every joint system. Interestingly, though, this disorder causes problems in the forefoot of people's feet with rheumatoid arthritis, and this is a fairly normal-looking foot. I'd like to show you an X-ray, but it just wouldn't show up very well. I'll try to emulate how a rheumatoid forefoot disorder occurs. Usually, the big toe goes over like this, and it's kind of hard to do with the model, but all the toes just start to fall over like that, essentially dislocate out of the joint. And it's amazing that people don't have more pain with this, but sometimes eventually when it gets really severe they do, because these bones on the bottom start, the toes go up and over and the bones stick out the bottom of the foot. And that creates a lot of pain for these people and debilitation. Now, that's pretty much how, and rheumatoid arthritis is the disease that causes this. It causes weakening of the joints, weakening of the cartilage, and the forefoot, because there's so much pressure in this area, just essentially falls apart.
How is rheumatoid forefoot disorder treated?
Well, there are, depending on the severity of the disease, there are certain things that we do to accommodate this. And the first way we treat this is conservative treatment through accommodation, utilizing special orthotics or shoes that are custom-made, or orthopedic shoes that have custom insoles in them to help accommodate the bony deformity of the forefoot. And sometimes the deformity is so bad that really shoes just won't work, and people can't get around without having this problem fixed. So we have to sometimes do surgery on these. And that surgery is actually very successful, where we usually end up fusing the big toe together so it doesn't move and it's still straight and in alignment, and then straightening out the other toes. And unfortunately, we still have to pin these. The nice thing about this now is that you can walk the day of surgery. Before you had to stay off your foot for 6 weeks to 3 months, and now you can basically have all this done, have it all fixed, have everything straightened, and walk that day. So the technology has changed. We've come a long way in developing better techniques that are less invasive and more effective. So that's pretty much how we treat these things. The majority of people can get away, though, with conservative treatment, special shoes, special inserts, and if the problem progresses, they may have to have surgery in the end.
All right, thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Don't forget that you can ask your specialist questions on foot and ankle conditions only here on your4state.com. Welcome to your4state.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Of course, he's our specialist on foot and ankle conditions. Nice to see you, Dr. Michaels.
Thank you, Angie.
Our first question for you is, what is plantar fasciitis?
Plantar fasciitis is inflammation of the plantar fascia, which is a ligament on the bottom of the heel. You can see a foot skeleton here, and the calcaneus is the heel bone. And if you have plantar fasciitis, often you have pain on the bottom of the heel, oftentimes after the first step of the day, or if you've been sitting in a chair for a while and you get up and walk, you have pain when you first get up and walk. And again, the pain is on the bottom. The plantar fascia is a ligament that attaches to the heel in this area, and it goes all the way up to the toes. So people can have pain at the heel or along the plantar fascia somewhere in the arch. And it's caused essentially by wearing ill-fitting shoes, standing on hard surfaces, or having an increased body mass index. Those are some of the things that contribute to the pain in the heel.
Well, how would you go about treating it then?
Well, the treatment is conservative. 95% of people with plantar fasciitis get better with conservative treatment, which consists of stretching exercises. If you stretch out the calf, you'll also stretch out the plantar fascia. That's the most important thing you can do. A heel cup of some sort is appropriate. Orthotics, such as this one. If you look at the bottom, this is basically a shoe insert that goes into your shoe, and we put a hole in the heel to help off-weight that plantar fascia. It normally hurts at the insertion, or where the plantar fascia attaches to the bone, and what people often misunderstand is that a heel spur doesn't cause the pain. A heel spur is actually caused by the tightness of the plantar fascia. So when people say my heel spur hurts, it's actually the plantar fascia. And treating it with orthotics, a heel cup stretching. Sometimes we have to use medications like anti-inflammatory. Shockwave therapy is another way, and that's like a machine comes in and puts shocks on the heel, and it's essentially surgery without having to cut the skin, because the energy is directed at the plantar fascia through the skin, and that seems to make a great difference in about 80% of people. And then finally, if nothing works, and only 5% of people fall into that category, then a procedure called an EPF is performed sometimes if that's needed. And that is a fairly straightforward procedure where you have the plantar fascia cut, only part of it, and that lengthens it, and that takes away the tension and the pressure on it, and the pain goes away after that.
All right, thanks so much. Once again, Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Don't forget, you can ask questions about foot and ankle conditions only here on yourfourstate.com. Welcome to yourfourstate.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Of course, he's our specialist on foot and ankle conditions. Nice to see you, Dr. Michaels.
Thank you, Angie.
We want to know, why do patients with diabetes have foot problems?
Well, there's three reasons that occurs. The first reason is diabetes causes the blood flow to the feet to stop. It causes the nerves to stop working, and it causes the immune system in the body to not work as well. So if you don't have blood flow and if you don't have feeling going to your feet, and if something happens and you get a sore, you can't heal that. And the body has an organ dedicated to controlling blood sugar, and that's called the pancreas. And when that malfunctions, then things begin to go wrong and you get diabetes, and then these three complications can occur, and that's why it's so important for people to see a foot specialist when they do have diabetes.
All right, well, how do you protect your feet if you know you have diabetes?
Well, the main thing to do is follow up with your primary care doctor as well as a foot specialist. It's the standard of care to see a foot specialist at least once a year, if not more often than that, if you have problems. And there are certain things that you can do to prevent problems with the feet, and we implement certain things in our practice that prevents a lot of complications and keeps people out of the hospital and keeps people's feet safe, including diabetic shoes, which are special shoes that are extra deep, and they're lined with silver, and they have extra layers of padding, and they also have flexibility in